Lloyd Sederer, MD, expert in psychiatry and public health, and best-selling author of Caught in the Crosshairs of American Healthcare. Welcome back, and we're going to be talking today about AI, artificial intelligence in healthcare.
Yes, great topic and great to be back, Mark.
Thank you. Yeah, AI is like it just kind of exploded in the public arena, like just in the less than a year, like the last few months, and it just keeps getting better and better and more impressive. And I I feel like it's already taken away probably a bunch of jobs, even though people say it won't. I mean, it's doing things that I would have normally paid other people for. Chat GPT. The paid version is even smarter than the free version. People are playing with GPT 3.5 for $20 a month. You get access to version 4, which is like having like a super genius friend at your fingertips at all times. So it's incredible, and people are wondering if this is developing so quickly, where is it going? They have the Turing test, the test of like, can you tell the difference between an AI and a person? And they must, if they say no to that it isn't meeting that bar, I think they must be moving the bar, because I think it's already gone way past that.
But I
Um,
think that distinction is not general, that there are certain things that human beings do that AI doesn't do or cannot do. And that's particularly as doctors in the arena of healthcare, uh, decisions or information, deductions on their part about diagnosis, what to approve for treatment, for how long. That has a human element to it. It's not just a punch list. And as good as AI is and will be, surely because this is a prototype now, so it's going to just go through the roof. But that's my concern, is that we're rushing into something that we don't really understand what's right about it, what decisions it can make, where decisions can go wrong, and how to fix them. Because decision making by AI, nobody knows how it comes to decisions.
that's a good point, and that's been the fear of science fiction going way back, probably the 70s, maybe even way before that. That we don't know how it works. I remember they said that in the old version of Westworld from the 70s. The scientists are in the room while the robots are breaking down and taking over the park, and they said we don't really even know how these things work. We lost track of that a long time ago. And that's actually right now they're saying that we don't know how it works. We put a bunch of stuff together and it just started working. And um, so it is a little bit scary, and you can't always trust it. The thing hallucinates, it makes stuff up sometimes. You have to verify everything that comes out of it. Um, but on the other hand, like Steve Jobs had famously said, computers are like the bicycle to the mind, making us so much more efficient. This is like the rocket ship for the mind. I mean, we can just it, I don't think we should ever at any time in the near future turn healthcare over to robots and AI. But I think every doctor should have this at their fingertips, and whether it's to help them communicate more efficiently, to help them think, like to come up with ideas of like, I can't find the diagnosis, maybe let me ask the AI what it thinks, and I'm going to verify everything that it tells me, of course. um, or maybe even help me review this contract from the new hospital I'm going to go work for, and
That's
figure out.
that's because you're so prudent. But if you're running a massive operation insurance company, you think you're going to personally review its decisions? I don't think so. And on top of that, as I wrote in a blog that yesterday, he who pays the piper calls the tune. And who's going to be paying for this AI? Who's going to be paying for its adoption? Well, it's hospitals, doctors, clinics, insurers. They're the ones that will be paying and calling the tune, by which I mean that they're not going to lose money on whatever program they adopt. So the program, in a way, has to be wired in a biased way to protect their financial bottom line. That's not unlike how casino slot machines are programmed.
Yeah. Yeah, when you first started with that, I was thinking the house always wins. It's always
Yes.
rigged that way. So yeah, I can imagine, and that would be a scary thing, when your AI doctor seems to always make decisions that are financially good for the hospital and maybe not medically good for the patient. Um, I mean, we're already in that situation. We're already in the situation where systems are being designed to benefit the large institution financially and not always be on the side of the patient. When someone who goes in the hospital and they get medical treatment that makes them more sick, but the hospital gets enriched by it. And that could only get worse. You're right. That could go in an even worse direction when we have these brilliant systems that are helping them to further that.
Yeah, AI admittedly is very effective with tasks. So if you have to put together all kinds of data or put together all kinds of information, it processes it very well. That's what it is, a natural language programmer. But that's different. So tasks are going to be considerably aided, which may be filling out forms or filling out medical records, but not making decisions. That's where there need to be parameters. And my experience is that when something like this comes along, the momentum carries it without limitations, or that the limitations are so feeble, or they're not uh, they're not pursued, or they're not challenged by in any regulatory way, and in the way that you were describing, that we as patients and families, when we now try to dispute a decision about our treatment, we can't get anywhere. We just get, an endless phone chain. We have to fill out automatic forms. We don't talk to anybody. That's going to become even more so because to the extent that AI does all of that, there's nobody there to consider what decision has been made and perhaps not in your interest.
That's a good point. And I think I can imagine a large institution that may be a way that they would use it. Um, and that if you want to complain to your health insurance company that they're not going to, for example, they're not going to cover something, um, that you can call them and complain, and they'll keep you on the phone forever, and you can yell at them and scream, and it doesn't get you anywhere because I feel like that's a mechanism just to delay you until it's too late. Where what you
Yeah,
should
they're
really
not
be
to
doing is,
like, defeat you. That it makes it so aversive to contest
yeah,
anything that most people say, I'm not going to do that. And doctors who have no time to begin with don't want to do that on the phone because they don't have the time to spend.
yeah. And then the things that are really effective is when you look at the fine print, when you look at the contract that you have with your insurance company, or when they send you a denial and you read through it, and in the fine print, maybe 4 or 5 pages in, it says if you do this, this, and this, if you fax to this one phone number within 24 hours and make this kind of a case for yourself, you're like, oh, so I don't have to talk to a person on the phone and get a form faxed to me, and I can just, but that's not everybody is comfortable or can easily read through 10 pages of fine print. But
Or
now
have a
maybe
fax
we,
machine, for that matter.
yeah. So
The,
so
the
AI
so
can be
it
our advocate in that way.
sets the bar very high in terms of being able to talk to anybody, appeal a decision that has great impact on you and your family. That's what I'm worried about here. And this is all driven by for-profit corporations that run insurance companies, large hospital chains, private equity companies. They own healthcare now. And this whole process is already determined by their insistence, their requirement that they make a profit. Profit becomes before patients. And my concern is that AI is just going to be another tool by which they profit and we suffer.
Yeah. Yeah. It's something we definitely have to be careful of. But definitely as informed consumers, we have to arm ourselves with AI. If it's an arms race of us versus them, and they're trying to outdo us, we have to have our own weapons of intelligence on our side and learn and become comfortable with it. Because I'm surprised how many people I talk to on a daily basis that say I don't like to use a computer. I'm like, well, not only do you have to use it, you should be in there with the AI, learning how to converse with it, how to use it, what it can do, how it can help you, that it can help you interpret documents, it can help you look things up and learn about things. And rather than the old way, which is the old way from a year ago, that you go to Google and type in a search, but now
Mhm.
your search results are like dominated by whoever can game the system and get to the top, and you don't always get the information that you need. So we all have to learn how to navigate this and arm ourselves with
But
information. And
there are some people who are wizards at this, like you, and there are some people who don't even own a laptop computer, and some people whose capacity, talent, skill with that is really quite limited. And learning new programs, learning what are going to be staged uh, programs. So you have 3.5, then you have 4, and then in 6 months or a year, you have 5. And each
yeah,
of those is a learning curve because each of those will be different. And that kind of demand upon people who are not, don't spend their time creating things on computers, they're going to be left behind.
yeah. I, sometimes it seems like American healthcare is hopeless. Everyone has an idea of how to fix it, and I sometimes think like maybe the only solution is to leave. Like I mean, not leave altogether, but there's a guy I was following that he travels to Monterrey in Mexico, which is apparently a super modern city and has as modern healthcare as we have, and says he gets much better care there, and he commutes back and forth. Not everybody can afford to do that either.
Yeah,
So then that's
yeah.
the question: how
That,
do we help people that
no,
can't do
that's
that?
That's very expensive because even before you get on the plane and hotel, you have a
Yeah,
concierge charge of, I don't know, 10, 20, $30,000, $50,000 a year just to be able to see that doctor. So it's very prohibitive. It increases the divide between the haves and the have-nots. So we have a problem here that nobody's going to stop the advance of AI because you can just see, you more than me feel its power and not and that it's going to proceed. And my suggestion about this is that the ones that have to call the tune are doctors and other healthcare professionals, not MBAs and CEOs, which requires that they are intimately involved with the development of a program and are decision makers when it comes to buying or adopting a program. Because there, we doctors are the best defense against for-profit companies, which want to say no in order to make money.
yeah, that's a good point. Um, and you spent decades in public health of making things better for people. Like it's easy for me to say, let's go to Mexico and get better health care, or let me go take care of my own family and make sure that they get the best possible health care with whatever resources I have. But you were out there helping people on the streets that people that might not even know, they don't know even know who you are, but they were benefiting from the hard work that you did. And so maybe we need to get good people in public health ongoing, um, people in that are interested in medicine and public health. And I know that you're also a professor of public health at Columbia. How are we doing with students? Are there people interested in that career?
The growth has been significant, particularly at Columbia. The Masters in Public Health MPH program has just ballooned to several hundred people a year, and then many stay on for postgrad work. So the workforce is increasing. But these are analysts, they're not decision makers. So you can get information, this really critical information that's supposed to direct things like with infectious disease, accidents, and in this case, healthcare, they're very useful. They're very, very useful if their thinking and their opinions are considered and are a big factor in terms of what happens in the street, poor people, poor neighborhoods, rural neighborhoods, and so forth.
So today and maybe in 5, 10 years, uh, say that a person goes into the hospital and they're now admitted to ICU. And maybe somebody's parent or grandparent, and the family goes in to visit, and they're concerned, that things are not going the way that they should be going. And now maybe we have AIs involved with the medical decision making, and the nurse says, we've determined that we need this kind of treatment or that kind of treatment, and everything, things just don't look like they're going well. What's the best course of action for your average person in that situation?
Well, doctors have lost just about all of their control over medical care and their patients. And that's there's a revolution going on about that because there are two tools that doctors can use and are starting to use. The first is unionize, so you can strike. And the second is contracts, money. So we saw how effective unions are, not just with nurses, but with Hollywood writers. Doctors who unionize can then hold that power to not go to work, to strike. And if you want to strike at the heart of a for-profit business, cut its revenues. Don't let it earn money because you're not there. So that's unionization is critical. And contracts, another way. So there's a good example in Southern California of a very large physician group that had a contract, managed care contract for Medicare, and did not renew its contract. And at the end of those 30 days, it didn't, and 30,000 people were suddenly without a doctor or a place to go to. That is very hard for us doctors to do because we've essentially shut off the oxygen for these people, but it's already happening. And unless we have regained clinical control over patient care, we're just going to be run over all the more and people that we care for as well.
Yeah, it's interesting that you mentioned Hollywood and the screenwriters going on strike, because that was part of their concern, was AI taking over their jobs. That
Yes.
and they negotiated to that AI cannot do their job, because uh, today, right now, Chat GPT 4 can write a very good screenplay, and which isn't really fair. And I don't think it's what anybody wants, is to have a computer writing the programs that we're watching. And they want to protect themselves going forward. So yeah, so we doctors ideally, is it true that can doctors have a union? I had thought that somehow that was illegal, or that's
No,
what we were told.
it is not illegal. And there are examples, very few. I think there's a public hospital in Massachusetts where the doctors are unionized. I'm sure there must be others, but they're a very small fraction of doctors are part of a union. And doctors in large practices are the ones who are in a position to hire a union in order to stand their ground by threatening to not show up, strike.
I believe there's also been a movement of doctors breaking away from the oppressive the boards that certify them. That where they, they're these money making organizations that give them more and more things to do to stay credentialed. You have to do modules, and you have to do more and more modules and more testing. And so some doctors are going to alternate boards. If a board is required for them to practice, and doctors in situations where they don't need, for example, me in family practice, I have never needed my board certification. I've never worked at a job that required it. No one has ever asked me if I'm board certified, even though I have been. And I had a job that required me to be board eligible, meaning that I could take the exam and could get board certified, that I had done everything, I had done a residency. But so yeah, I think that there's a lot of doctors that are rebelling and trying to do things differently. There's direct primary care. people can look up direct primary care where you can have a low cost subscription to go to a doctor and bring your family to a doctor, and you pay every month, and they get you testing and they get you things at a lower price, and then you only need catastrophic insurance to cover the hospital, but they cover everything that you normally would have. So you save a lot of money on insurance and you get better care because you have better access to the doctor.
That's, of course, true if you're have the sophistication and the nuance to do that. But what is that, like 2% of the population, 4% of the population? When I think about Medicaid patients, poor patients on Medicaid in New York State and in the country, it's a huge expenditure, which essentially is determined by the Medicaid program, what its budget is going to be, and who is going to be allowed to participate. That is what is going on. And poor people, they don't have a chance against that. They're subject to whatever the decisions, and they're lucky, in fact, to have access to any care because that's become more and more difficult to achieve.
Yeah. Yeah, definitely people in those situations need advocates at any level. I mean, at any time in history, whether it's now, 30 years ago, 30 years from now, people that are not able to advocate for themselves need people that are able to and willing to stand up for them and make sure that they're taken care of, that they have the rights to health care and nutrition and everything, the basic requirements of living.
Very hard to achieve that kind of control, to protect people, because the interests at work are not for those people. It's we've got to do something with these people rather than we're going to improve their lives, we're going to improve their health, at whatever cost that requires. That's unheard of in healthcare, and I think that's what you're talking about.
Yeah. Um, do you think that that America, the United States, would benefit from modeling our healthcare after any other country in the world? Like, is there another country that you think is doing it right that would work for us?
When people look internationally and compare the United States on a number of major quality measures, we're at the bottom of a list of 6 or 8 other very familiar countries, not just Canada, on these kind of markers. How long do people live in their country? And we have the shortest lifespan compared to these other 6 or 8 large countries. The other is that we have higher rates of chronic disease, multiple chronic diseases, diabetes, heart disease. And these are, if not preventable, you know very well, they can be mitigated. People can not die from these if they're treated. We have the highest rate, the US has the highest rate of infant and maternal mortality. Can you imagine that? More women die giving birth in this country than in any of these large countries. And we have then these epidemics, which are not being effectively approached: drugs, opioids, infectious disease. I mean, we were not a model country for introducing uh, safety features as well as vaccination against COVID. So we have chronic disease, we have suicides, we have overdoses. In all of these categories, the United States ranks at the bottom of the list. And
Yeah.
these countries, like you mentioned, like Canada, United Kingdom, the Netherlands, Germany, Japan, familiar countries that are doing much better keeping people alive, keeping us alive as a population much longer.
Yeah. Yeah, it's difficult to even get people's attention these days. Everyone is on social media and has an attention span of anywhere from a few seconds to a few minutes at best. And then when you put a video on TikTok and everyone's like, well, that could be the Chinese government trying to get to us or something. So yeah, it's not easy to get the word out and get people to pay attention. And but yeah, I believe everybody should read your book, Caught in the Crosshairs of American Healthcare, and it's very important that that we do educate ourselves and make a difference, and demand that lawmakers, long term at least, you said before it's a lot of short term solutions, but long term, we need to look at changing things here.
Absolutely. And thank you for mentioning the book. And I do want to say the book is not a technical book. It's not a management book. It is a book full of stories and about my firsthand experience as medical director of a Harvard teaching hospital, where managed care and for-profit insurers wanted to bring us down on our knees. And we fought that and we won, but it took a long time. So I have firsthand experience about how perilous what we're talking about is and how hard you have to fight to save a hospital and to save its capacity to treat patients in with really good care.
Yeah, and it is possible, right? It is possible that they didn't force Harvard to start giving people like McDonald's fast food healthcare, right? You guys kept your standards and also worked with the system.
Well, the medical school is separated from the Harvard hospitals. There's affiliations, but in many cities and states, the medical school runs the university hospitals. But they're two separate things in Massachusetts where this happened for me. So the medical school wasn't going to step in here. And it was about now groups of large groups, powerful groups of hospitals that came together, like Partners Hospital, which is Mass General and Brigham. And there were several others like that. And we were in the Mass General system. Now it's Mass General Brigham. And Mass General was not a charity. They weren't going to treat us like a charity. They weren't going to give us money. In fact, they wanted to close us. Not everybody, but you know, a hospital that loses millions of dollars a year doesn't deserve to persist, even though it's been there for 180 years. So we had to prove it, and we had to not just save money, we had to completely change the model of care by which people were served in a hospital, and we did, and we survived, and it's prospered since then. So that's what Jim Collins called uh, built to last.
Wow, that's incredible. Dr. Lloyd Sederer, thank you for joining me. This is an incredible conversation. Thank you.
Same here. Thank you. Love working with you, Mark.